In this video, I'm going to talk about how to approach the emergency scenario. This is one mistake many doctors do. Okay, so when you're actually dealing with an emergency scenario, you use a strategy called reverse engineering. Okay, so the reason I say reverse engineering is in your other history taking scenarios or in your general scenarios, what you do is you introduce yourself. You will take history of presenting complaint, then take past history, then relevant history, then you will ask the consent, then you will examine the patient, and then you will explain the management. Okay, so this is the normal way or traditional way of dealing with a patient in an real life or in an OSCE scenario. But when you think it's an emergency scenario, we try to do few things slightly different. This is because you will actually impress the examiner when you do it this way. It's called reverse engineering because you're actually doing things in a slightly reverse way or a different way, and you will be saving your patient as well. The most important thing is you are saving the patient and you are actually impressing the examiner. When I use this strategy, the examiner told me no one, in the exam, in my real exam, after I finished this station, he said, "Doctor, you did this very well. You dealt this scenario like an emergency physician." And he said, "Today, not even a single doctor used this strategy. So I'm going to teach this strategy to you guys." And so all we do is, when you're standing outside the room, you will actually, when you read the scenarios, you should know what is an emergency, what is a non-emergency scenario. Okay, so simple things like cough, earache, sore throat, all these things are usually non-emergencies. Okay, but emergencies are if you see chest pain, severe abdominal pain, patient is not breathing or difficulty breathing, was found unconscious, anything like this is an emergency scenario. Okay, or the patient had a peanut sandwich and now he is having difficulty to talk, or he was working in the farm and he is collapsed. It could be anything. It could be a snake bite, it could be spider bite, or it could be an atrial fibrillation, or it could be anything. Okay, okay, so that's when you actually think that it's a emergency scenario. And once you come into the room, you will. What you do is, first thing you do is you look for vitals of this patient. Okay, for example, if you have an examiner in your room, some of the exams will have an examiner, some of the exams will not have an examiner. Okay, so what you do is sometimes they will give you the vitals outside the room. In that case, that's okay. You go inside, you introduce, and you will try to stabilize the patient first. Okay, so what I used to do is, usually in my exam, they never used to give me the vitals. So I will enter the room and we will have an examiner, and I will introduce myself to the examiner and I will say, "Doctor, is my patient ill or well?" Okay, that's the first thing I will ask. Okay, if the examiner tells me, he is well, then I will proceed and I will take history. If he says he is not well, then I will actually ask the vitals of my patient. Okay, so doctor, can you please tell me the pulse, blood pressure, temperature, respiratory rate? And you will actually then go to the patient, introduce yourself again, and start taking further history. This is what exactly I used to do when I was a resident medical officer in the hospital, in the emergency department. I used to think, how will I deal with an emergency scenario in real life? Then this is what I used to do. The first thing I do is I will first go to the patient's bed. I will look at the monitor where I'm actually looking for pulse, blood pressure, temperature, respiratory rate. It's all on the monitor there, and the oxygen saturations as well. And based on that, I usually go into the room and then, I will take history, or, I might put a cannula or, intravenous cannula and give him some fluids and stabilize the patient, then take history. Okay, so you got the point there. So first thing you do is you will see is the patient ill or well, and the second thing you do is you will stabilize the patient. If the blood pressure is low, in the exam, tell the examiner, doctor, the blood pressure is low. I would like to put a cannula in, and I will give him normal saline as a bolus. I will draw some bloods and I will take history next. See, by telling this, the examiner is thinking you are a very safe doctor. Okay, so this will actually increase your chances of passing the emergency station than any other way, because this is what we do and this is what you do in real life. You will see is the patient ill or well, stabilize the patient, then take history, isn't it? Or while you're drawing blood, you can take history, but in exam scenario, you can't do all those things because it's a fake scenario or it's an ideal scenario. So I usually, when I'm actually taking blood or when I'm putting a cannula in, I take history. History again, very focused history. Okay, so how can I help you? If he says, doctor, I'm having this chest pain, then I will offer him some analgesia, saying, would you like something for pain before we talk? Okay, see, that shows that you have empathy for the patient. Okay, so when you do all these things, you will impress the examiner and the patient. And believe me, when you do this, the patient will love you. Okay, I hope this has helped. Make sure you practice this. Without practice, you will probably not learn anything of what I'm teaching, because unless you practice, you can't put all these things into action while you're actually in the exam scenario. So do role plays with your friends, and I think you will smash your exam.